Welcome back guys. Now in this video let's discuss about pressure volume loops. So we are going to draw a graph between pressure changes in the lung, that's the intrapleural pressure changes in the lung, and volume changes in the lung. Okay, so on x-axis what I am showing you the pressure changes. Intrapleural pressure is getting changed during inspiration, and tidal volume is a voluminous change in the lung. So volume change by pressure change. So delta V by delta P. So delta V by delta P will give us graph for compliance of the lung. So this is the graph which is showing the compliance of the lung. Now there is not one single line here. Actually the compliance of the lung during inspiration is different and the compliance of lung during expiration is different. Now from this graph we can clearly say that this is the compliance curve during inspiration. This is the compliance curve during expiration. Now my question to you is, sir, which curve is having more slope? More slope. Sir, the expiration curve is having more slope. It's having more slope than inspiration curve, which means where the compliance is more, the compliance of lung during expiration is greater than inspiration. Or we should say something like this. Sir, we are having the same lungs. Same lungs are present during inspiration as well as during expiration. But your lung compliance changes during inspiration and your lung compliance will be different during expiration. So the path of inspiration and the path of expiration, they are not the same. There is this difference. So this difference is called as, hysteresis. Okay, this difference is called as hysteresis. Now we will discuss why the lung compliance is different during inspiration and different during expiration. That we will discuss now. From this graph we can clearly see the compliance of lung during expiration is more than the inspiration. Why it is so? First we will see during inspiration what happens. Now we all know that during inspiration alveoli are going to expand. Now when alveoli are expanding, for example, look at here, alveoli now which are something like this. During inspiration what will happen? Alveoli are expanding like this. Normally in the alveolus, here are the surfactant molecules present. Here surfactant molecules are present. Now what is the function of surfactant? Surfactant decreases the surface tension. Now during inspiration what will happen? Now the surfactant molecules are moving away from each other, or I can say the surfactant is getting diluted away. Now when the surfactant is getting diluted away, what happened to the surface tension? So surface tension during inspiration is increasing. Now when surface tension increases, what happened to the compliance? Surface tension and compliance are opposite to each other. So when surface tension increases, the collapsing forces are getting increased. So what happened to the stretchability of lung, or what happened to the compliance of lung? Compliance of lung decreases, sir. So we can say that during inspiration, lung compliance is becoming lesser due to increased surface tension. Okay, please concentrate here. During inspiration what is happening? The alveoli are expanding. Now let's see what is happening during expiration. Now we all know during expiration what happened to the alveolus? Now alveolus is collapsing, alveolus becoming smaller. When the alveolar size becomes smaller, what happened to the surfactant concentration? All the surfactant molecules are coming close to each other. When surfactant concentration increases, now the surfactant molecules are getting closer to each other. Now surfactant concentration increases. Now when surfactant concentration increases, what happened to the surface tension for during expiration? Surface tension decreases. When surface tension decreases, what happened to the compliance? Surface tension is not there, collapsing force is not there, recoiling force is not there. So now lungs are more easily stretched. With a little giving pressure, the lungs will be easily stretched. So surface tension decreases, so compliance, okay, compliance increases. Okay, sir, how can we say that lungs are more compliant during expiration? By looking at this graph. Okay, now we will see that. See, now lung volume at any given pressure, lung volumes at any given pressure during inhalation is less than the lung volume at any given pressure during exhalation or expiration. For example, let's take one pressure, minus 5 mm Hg. Now at minus 5 mm Hg, please concentrate. Okay, I'm just drawing a line like this at minus 5 mm Hg. Now what is the volume change that's happening in the lung during inspiration? See, during inspiration, the volume change that has happened in the lung is somewhere around, for example, 100 ml. Okay. Now, what is the volume of lungs at say minus 5 mm Hg pressure? Now look at here, this is expiratory curve. Now I am drawing like this. Now here it will be somewhere around 300. Now where more volume change is there? More volume change is seen during expiration. At the same pressure, at a given pressure, there is more volume change in the lung during expiration than during inspiration. Okay. Now what is the reason? I have explained to you. During inspiration, surface tension inside the lung increases. During inspiration, the surfactant molecules are dilated, or so surfactant molecules are diluted. So surface tension increases. So when surface tension increases, automatically compliance decreases. And same is opposite. During expiration, the lung is collapsing or the alveolus are collapsing. Surfactant molecules comes closer to each other. So surface tension decreases. So compliance increases. Okay, so that's what I have written over here. So during expiration, alveoli are contracting, surfactant becomes more concentrated, surface tension decreases, compliance increases. Okay, so this is what I want you to know regarding the pressure volume loop. Having said that, now let's discuss different conditions where the pressure volume loops are getting affected. Okay, now see, here I am showing you this dotted line. Let's take it as an average compliance. Okay, average compliance or the normal compliance. Okay, in healthy lungs. Now, in this graph, what I am showing you, see the compliance curve in this given condition is now getting more towards the y-axis, which means more slope. There is more slope for this curve, which means more compliant. Now these lungs in this condition are having more compliance than the normal lung. Which condition, sir? Emphysema. We have discussed in emphysema loss of elastic recoil. Whenever the elastic recoil is lost, lungs become more compliant. So in this graph, we can see that compliance is increased. Now the compliant curves are more more moving towards the y-axis. Compliance is more. If a curve is moving towards the y-axis, its slope increases, compliance increases. Okay. Now let's see the other condition where the compliance is getting decreased. See, this is the average compliance, normal compliance. Now, see the compliance curve is falling towards the x-axis. Slope is getting decreased, right? There is no slope. Slope is getting decreased. So, when the slope decreases, compliance is decreased. In which condition, sir? In which lungs compliance is going to be decreased? Pulmonary fibrosis. Okay, in pulmonary fibrosis, acute respiratory distress syndrome and atelectasis, total lung is collapsed. Now, it's very hard to open these lungs, or the compliance of this condition, compliance of the lung in these conditions is reduced. Okay, so compliance is reduced in this condition. Now, let's talk about saline-filled lung. Already we have discussed, guys. Saline-filled lung, there is no air-water interference. There is only water present inside the lung. Whenever there is no air-water interference, there is no surface tension. Whenever there is no surface tension, there is no collapsing force. Whenever there is no collapsing force, it is easy to stretch the lung. So, compliance increases. In a saline-filled lung, compliance is more. Okay, so that's why please concentrate here. The compliance curve is more towards the y-axis. It is moving towards the y-axis, and even appreciate that hysteresis is not there. In a normal lung, this difference, hysteresis is due to what? Hysteresis is due to surface tension. Surface tension during inspiration is more and surface tension during expiration is less. So because of this, there is a difference in the compliance during inspiration and expiration. But what I am showing you here, see, the compliance is increased. We can simply say why? Because the curve is more towards the y-axis, slope increases, so compliance is more. And also appreciate there is no hysteresis. Why? Because there is no surface tension. Why there is no surface tension? Why? Because there is no air-water interference. In a saline-filled lung, entire lung is filled with the saline. So there is no air-water interference. So compliance increases, and even there is no hysteresis. Remember this one point. In a normal lung, the compliance during inspiration, the compliance during expiration are different. So this difference is due to surface tension. The difference is called as hysteresis. So hysteresis is due to surface tension. Okay. Now having said that, now look at this one question. We are having 3 subjects with equivalent A, B, C compliance curve. Okay, this is the compliance curve of A, B and C. Now one person is normal. Okay, one of the subject is normal and one is suffering with emphysema, and the third person is using drugs like amiodarone and bleomycin. So which of these compliant curves is normal, and which of the following curves is the person who is having emphysema, and which of the following compliance curve is the one which is seen in that person who is using amiodarone or bleomycin? See, it's very simple. Let's take B as a normal person. Okay, normal. Okay, this is the normal compliance curve in a normal person. Now we can clearly say that see curve A, it's having more slope, it's more towards the y-axis. So definitely curve A is having more compliance. Okay, curve A is having more compliance. In which condition compliance will be more? Sir, in emphysema. Okay. Okay, in emphysema compliance will be more due to loss of elastic recoil. Okay, now let's talk about the C. We can clearly say that the C curve or the compliant curve C is having less compliance. Why? Because it is more towards the x-axis, slope is falling down, it's having less compliance. Now in which conditions the compliance is going to go down? You know, in atelectasis, in pulmonary fibrosis. But in this question, the person is using amiodarone. See what happens when the person is using drugs like amiodarone, bleomycin, methotrexate, okay, cyclophosphamide. All these drugs will cause pulmonary fibrosis. Okay, so these drugs using like if the person is using drugs like amiodarone, bleomycin, carmustine, cyclophosphamide, okay, these drugs will cause pulmonary fibrosis. Whenever there is pulmonary fibrosis, what happened to the compliance? Compliance decreases. So C curve is the compliance curve in the person who is using amiodarone or bleomycin. Because of pulmonary fibrosis, compliance is now decreasing. So in this video, I have discussed what exactly is the pressure volume loops and how the pressure volume loops are going to be affected in different conditions. We have also seen about the hysteresis and what are the causes of hysteresis, and also we have seen what are the different conditions where the where the pressure volume loops are affected. Hope the video is helpful. See you in the next video. Thank you.